In the meantime, Michelle, our new nurse, came up to me and said, you know, do you need to do a wee? And I was thinking to myself, well, I probably could, but that's none of your business. Why are you asking me? And she was looking at me, she's like, because we need a sample, because we need to do a pregnancy test. And I was like, okay, I've never had to do that before. And she's like, yeah, well, we have to now at 12 months. And I was like, okay then, cool. So I went and did what was necessary and came back, and Dr. Leone called me into his office. So I went in there, had a talk to him. He asked me how I was doing, you know, how much I've lost, if I wanted an adjustment. I said yes. So we went through to the procedure room, which is just off his office, and I laid down on the bed, you know, got myself into a position to have the adjustment, which basically involved me pulling my shirt up to my bra level and pulling my skirt or pants down to below my belly button. And then he feels around for my port. Once he's located it, he sticks a really long needle in it. Usually I don't get any warning that he's going to stick the needle in. He kind of just feels around and jabs, which I think he just does that with me because he knows I'm not funny about needles. I'm hoping he doesn't do it with everyone, because those who are funny about needles, it would be quite a shock for them. But no, with me, I just expect him to jab me randomly, so it's not really a big deal for me. It just feels strange. Like I kept saying to Michelle and Dr. Leone, it doesn't hurt so much. It's the sting of the needle, obviously, but it feels strange because the port is foreign and it's not part of my body. It's not meant to be there, and I can tell that it's foreign because it doesn't have feelings, if that makes any kind of sense. So when he's got the needle in the port and he's kind of pushing the fluid in, I can feel the port pressing down on whatever organs are underneath it, and it feels very, very strange. And I usually get quite a lot of pain afterwards from that because he's pushing down to get the fluid in. And I get a little bit of a bruise, I think, an internal bruise. But it's usually gone within a day. Like now it's Saturday and I had it on Tuesday and I feel fine. No ill effects whatsoever. I can always feel the fluid on my stomach as he's putting it in. It gets heavier. I can always feel that. It's not always a dramatic change, but it's just gradually more pressure on my stomach. So that went perfectly fine, no problems at all. Dr. Leone was actually telling me while he was doing it that out of all the percutaneous placements he did 8 of them. Oh no, he might have done the second lot of people that way too. I'm not sure. But out of the first 8 of us that he did, mine was the one he got perfect, which is it's quite a good thing, obviously. I'm glad he got it perfect for me. But then there's other people he didn't get it perfect. And quite a few people have had to have their balloons taken out because of problems that aren't his fault. I'm not blaming Dr. Leone for them, just, you know, it's a medical trial, you can't expect everything to be perfect. But apparently mine was placed perfectly and I've had the least amount of problems out of everyone, so I'm quite happy about that, but for other people that sucks. So anyone else who's watching this who has had problems, I'm sorry guys, I happen to be the perfect one, you've just had bad luck. And I would hate to be in your shoes, so I hope you guys get over that. And get better soon if you're having problems with it still. Yep, so where's my next little thing? After that, Dr. Leone left me with Michelle to do my measurements and my temperature and my pregnancy test, which came up negative, as you guys would love to know, I'm sure, which you didn't want to, because I had an contraceptive implant put in my arm a month before surgery. As a part of our contract, when we sign our consent forms for the surgery, for female patients, we're not allowed to get pregnant for the 3-year trial, just because they don't know the effects of the implant on an unborn child. They don't know if the calorie restriction is going to affect the child. They don't know if the placement of the balloon is going to affect the child. Basically, if we do get pregnant, they take all the saline out of our balloons and kick us off the trial. So I thought 3 years worth of my life to have a better lifestyle is worth it for me. So I got a little contraceptive implant thingy to make sure that I didn't get pregnant and stuff up their trial. I don't know if anyone else has done that. It's a good idea if you haven't, because it lasts 3 years as well. So yeah, I had my 100 ml adjustment, and then as I was leaving, Michelle gave me my box of blood test tubes, so I had to go have my blood tests done, which was hopefully the last lot for a while, because they do quite a lot of blood tests on us, and they take a lot of blood. This time I had 10 tubes taken, and if you think about normal blood tests, you have maybe 1 or 2 tubes, 5 at the most. I had 10 taken, and I'd already been fasting to have my adjustment done. A little bit of information for you balloon people: always fast before your adjustments, because if you don't, it freaking kills. Trust me. So that was kind of a good coincidence, because I'd already been fasting and I had to fast for my blood tests, so I just went and got them all done in one go. After that, I went and had a lot of sugary drinks because I was feeling quite faint. So yeah, that have blood tests done. Hopefully that's the last I have to do for a while, because I'm really not enjoying them. Not that I have a problem with needles, it's just they take a lot of blood and it's a pain in the butt. I need to buy myself some scales. It's something I need to get onto doing. I had a look yesterday at the shopping centre, and the $9 scales I found only went up to 120 kilos. I'm still like 13 or 14 kilos too heavy to weigh myself on those, so I didn't even bother looking at them. The next ones up were 100. They went up to 136 kilograms weight, and they were $25. So I whacked them on the floor, calibrated them all, made sure they were right, hopped on them, and they maxed out. And I was like, well, that can't be right because I'm 133 kilos ish. If it's 136 kilos that this can weigh up to, I should be able to be weighed on them, but they still maxed out. So I thought, okay, well, they suck obviously, and put them back. And the next ones up were 150 kilos. They weighed up to 150 kilos. They were $50, and they were glass. And I did not like the idea of standing on glass scales. If you're a bigger person like I am, you'll know what I'm talking about. We don't like the idea of sitting on chairs because they collapse. Plastic chairs especially. Those fold-up metal flimsy chairs, they like to collapse on us. And standing on glass scales with 130 kilos odd of weight does not seem like a good idea to me. So I might have to have a look around at different department stores and try and find a set of scales that will weigh me and not cost the earth. So, because I really do need to keep track of what's going on. I don't want to have to wait every 3 months to be weighed in. And I think hopefully if I do get them, I'll be able to challenge myself to do a little bit more and try and see more weight loss. And hopefully I won't get too obsessive with them like I used to. I can't think of anything else to say. Oh, this video is the first one that's actually relevant. Like, this is the first one I've done after releasing my videos. So this is up to date. You guys are seeing them as I do it now. There's not going to be any more past ones to watch. From now on, if you want to ask questions, put them in the comment section. I have set the comments that they only get posted on approval, which is a lovely new thing on YouTube, I've noticed. Just because I still don't want negative comments. People could be real dickheads and assholes. So, excuse the language. I will approve comments that are relative to my balloon journey. Anything that is irrelevant and offensive, I will not approve. But questions, ask them in the comment section. I will approve them and I will answer them to the best of my ability. If I get a lot of questions, I will do a video response. Feel free to ask me anything that's, you know, pertaining to the balloon trial. I'm an open book. I tell most of my friends, you know, I don't keep secrets, I don't have secrets, I tell things how they are. If you've got a question, ask me. The worst response you can get is no. You know, I'm not going to answer that. So give it a go. Anything within reason, of course, people. If you're going to be asking me super personal questions, I'm probably not going to answer them. But anything to do with the balloon trial, you know, ask. It can't hurt. You can only get one of two answers, yes or no, that I'm going to answer it. So give it a go. Yeah, anything you want to ask, give it a go. I keep saying that. Sorry. That's about all I could think of for now. I need some kind of cool catchphrase to kind of end these videos with, don't I? I can't think of anything cool, so I'm just going to say toodaloo. See you later, guys.